Stephen, I have
mhm.
a question. How does this technology differ from other body contouring systems that might be out on the market?
All right. Well, you guys already know what my first answer is going to be. So we're the only ones that actually reduce fat, right? Currently, proven wise, right? There might be something out there, but nobody knows about it, and there's no stats on it. There's no certs on it. So number one is if you're looking for a non-invasive fat loss laser, this is the only option. Number one. Number two, we are using two different forms of laser. A lot of people get fixated on the red, right? The red light that they see because it projects red. All the other contouring devices out there are red. One thing that people just forget to do is go back to biology and look at like how our cells respond to certain colors. And adipose tissue does not have any absorption properties with red light. It just doesn't absorb. So red can't stimulate any type of cellular respiration or anything within those cells that deal with fat reduction. So red doesn't get it done. We utilize red specifically with our technology to get consumed by the skin and stimulate collagen production and really be kind of like a lead blocker for our infrared, which is the workhorse for the cellular metabolism. Infrared at our frequency, which is 980, has one of the highest coefficient energy absorption rates in adipose tissue and yellow pigmentation. It's all color
Mhm.
based. So,
Right.
the biggest thing is if you got a red light, you got a great device for tightening skin. It absorbs great into the skin. There's
Hmm.
also other health benefits of it, but specifically for, if you're looking for a tool that is supposed to work for fat reduction, red doesn't get it done. Infrared is what we found to be the absolute best, and that's why we utilize it. But we use the infrared at 980, we use the red at 680, and they're coherent to each other, which means we are actually able to get those two lights lasers to bind prior to hitting the skin. Um,
Hmm.
and then we pulse it specifically depending on how far we need to drive into the tissue. So you've got multiple layers. You've got your epidermal, dermal, you've got your fascial tissue that between the skin and the fat, and then you have your adipose. So depending on the service line that we're trying to provide for the patient, if it's fat reduction, we've got to pulse this to drive into the fat tissue. If it's cellulite removal or skin tightening, something of that sort, then it's going to be lower. Most of the energy gets pushed into the skin. So we have a device that's variably pulsed depending on the service line.